So this is Dr. Brian Campbell. I wanted to follow up on the overview of the adult client history that I utilize in my private practice. We're looking at this as a tool to obtain information on a variety of different factors that may be related to the origin of the client's problem, the current manifestation, and development of the problem. So we're really multitasking. We're looking at different, if you look to the right here, different levels of analysis that we talked about before. We might be looking at biological factors, physical factors, interpersonal factors. So let's continue the overview of the form, and we're basing this on a female. The marital history, we want to look at her husband, her marriage, if she's married. If she's not, then we'll look at that as well. But is there compatibility? Are they having marital problems? That level over here on the right-hand side would be the communication, family systems, marital. And that's important to look at in terms of the relationship between those factors and the presenting problem. Then we go to family history. Family history is really important because we're looking back to see what kind of influences the person had as a child. What was the personality of her father? What was the personality of her mother? What was it like being raised in the home? That's the next question. What was the home atmosphere like? So we're obtaining information about the family systems, which have a profound effect on an individual's belief systems and what problems he or she might be exhibiting. Were you able to confide in your parents? Did your parents understand you? Now, there's a little question down here tucked in also on religious training. What type of religious training? Of course, that we're looking over here at the supernatural or spiritual aspects. We're looking at the upbringing in terms of her faith and what type of training she received in religion. That's very important. The actual faith and denomination would be important. And we'll follow that up with looking at Christian experiences. I have a handout for that, and see what specifically she was trained, and go into that much more detail in a separate form that I utilize. So continuing with this, we look to see whether she was a product of a divorce situation, whether anyone had alcoholism in her family, any significant problems that might have influenced her. Then we have a little section on the self-description, and that's what we call a sentence completion task, and the individual finishes these sentences and helps understand what that person feels about himself or herself. And those can give us a lot of good insights into the person is thinking, his or her thinking, and belief about herself. What feelings do you wish to alter or increase or decrease? Have you been in therapy before? That's an important factor to find out. And how did that go if they were in therapy? Those factors are very important in terms of learning and to see what influences the therapist might have even had on the client in the past and why maybe it didn't work out or did work out. So then at the end, we ask any information that the questionnaire may have missed. So we're asking for any additional information that the individual might want to offer. So this is just a brief overview of the client history. We are obtaining some at least introductory information on a wide range of factors. We're multitasking these different levels of analysis here, and we're following up. If we have physical problems, we'll follow up. If there's medications, we're going to follow up on medications. We're going to find out what the person's taking, what possible side effects there are, what disorders the person might have, what neurological problems that she might have. So we're going to be exploring a lot of factors here that relate to biology, that relate to nature, that relate to nurture, and relate to the supernatural. So I hope that you'll see how we use these forms to obtain information on a wide variety of factors relating to clients' problems. God bless everyone.